We will talk about top 5 weight loss supplements, their effectiveness. First, we should say that there are no magic pills, and all of them have some degree of effectiveness and not 100%, and none of them is 10 out of 10. Let's start with number 5. It's Garcinia Cambogia. Garcinia Cambogia is extremely popular actually, and it inhibits citrate lyase, its enzyme, and this enzyme is responsible to form fat cells, to grow new fat cells, and inhibit of citrate lyase inhibits growth of new fat cells. Also, Garcinia Cambogia increases levels of serotonin, and it improves mood and it decreases appetite. So it has two actions. First is inhibits growth of fat cells, and second action is increase serotonin and decrease appetite. But there is problem is in evidences, because there is no consistency in evidences and the result is not very prominent. It has some effectiveness, but this effectiveness is minimal and it's not very different from placebo. That's why Garcinia Cambogia has no very strict and consistent evidences, and I would rate it 3 out of 10 because lack of enough consistencies. And what is the optimal intake? Optimal intake is 1000 milligram per day before meal with a glass of water, and it is considered safe for several months, and after several months it can have some liver toxicity. Such cases are very rare but still important. That's why we should remember that Garcinia Cambogia can have some concern about liver damage. Second, or number 4, most important supplement is caffeine. Caffeine has several actions. It boosts metabolism. What means boost metabolism? It helps to release of fatty acids from fat cells, and these fatty acids are burned. Burn in direct meaning, it means that they are burned and energy released, so it boosts metabolism. It means it boosts metabolism and it increases energy expenditure. It means that person uses more energy even at rest, and person burns more calories even at rest. Caffeine has these actions. Also, caffeine is stimulant for brain. And there is important concerns about caffeine. It's tolerance and dependence. What it means? Tolerance means that over time you need more and more dosage of caffeine to get same effect. It's tolerance. And what is dependency? Dependency means that over time you become dependent on this substance, and you have withdrawal symptoms. It means you feel bad, you have headache, maybe you have irritability, you have nausea when you don't intake caffeine, or if you stop intake caffeine abruptly. So it has tolerance and dependency. That's why caffeine is not its main concerns of caffeine. And coffee and tea, both of them contains caffeine, and 400 milligrams is considered safe amount of caffeine, and it's about around 4 cup of coffee or 5 cup of coffee, sometimes it depends. And third most important and most well-known supplement is green tea for weight loss. It's very well studied for weight loss because it has lots of studies, and it contains catechins. It contains also other components like caffeine, for example, and other antioxidants, but catechins are most important part, which inhibits breakdown of norepinephrine, and norepinephrine is neurotransmitter, and when norepinephrine is breakdown of norepinephrine is inhibited, norepinephrine is activated, and it stimulates burning of fatty acids. It stimulates release of fatty acids from fat cells, and burning them. So green tea increases fat burning directly, literally, as we hear. It improves fat burning. Also, it slightly inhibits fat absorption, so catechins improve fat burning and slightly inhibit fat absorption, this dual action. Also, it accelerates metabolism but short period of time, and increase energy expenditure. And what we know about green tea, we know that over 20 weeks, when people intake green tea, they lose around 2 to 3 pounds more compared to placebo, compared to other people who don't intake but do have same style of life. How to prepare optimally when we make green tea? Optimal temperature is 160. It's around 70 degrees Celsius. You should avoid boiling, because during boiling these catechins and other antioxidants loses its action because they are degraded, so you should avoid their degradation. It's important. And steeping time should be 3 to 5 minutes, around 3 to 5 minutes, and safe amount of green tea is 3 to 5 cups per day. And it's better if you intake it between meals for better absorption. So how I rate them? I rate green tea 5 out of 10 because it has some effectiveness and it has some studies and it's important. And I rate caffeine around 4 out of 10 because it has some effectiveness, but it causes tolerance and dependence, and for me it's a very important red flags. That's why its score is 4 out of 10. In case of green tea, it's 5 out of 10 because it's safe. It's considered safe even for long-term intake. That's why it has important effectiveness. And second rank is psyllium. Psyllium is very important supplement, and it's one of the most effective supplement for weight loss ever known. What it does, actually, it's plant. It derives from plant, and it's soluble fiber. And what it means, when you intake psyllium in our gastric, it absorbs lots of water, and when it absorbs lots of water, it becomes gel-like substance. This gel-like substance causes fullness of gastric, and person loses appetite, and person loses desire to intake any other calories. So it's important, very important and effective characteristic of psyllium. Also, it helps digestion. It has anti-constipation action. It's very effective to treat constipation. That's why it's second huge benefit of psyllium. Also, it binds to carbohydrates and decrease their absorption. So it regulates blood sugar levels. That's another huge benefit because it binds to carbohydrates and prevents them from absorption, and we have low blood glucose level. So psyllium is almost perfect supplement, but of course it has some concerns also. What are the main concerns? Main concern is that it can absorb water very rapidly, and it can increase in size, and it can cause choking if you don't intake enough amount of water. If you eat powder of psyllium and don't intake enough amount of water, it can cause choking. So you should be careful. You should start with low doses and gradually you can increase. You can intake capsules. Capsules are much more effective, and 5 grams per day is considered very optimal amount of psyllium. And you should start with small portions and small doses, and you can increase doses over time. It's better if you intake before meal to decrease appetite, and before bed to improve your bowel movement in the morning. And you should intake it before 1 hour or after, at least 1 hour after any medication, because it can inhibit medication from absorption, and you can lose medication effect, other medication effect. That's why you should be careful. If you intake other medications, you should intake apart. And psyllium is considered safe for long-term usage. It's very important also, so it means that it's safe, it's effective actually, and I would rate it 7 out of 10. It's very important supplement from my view. And glucomannan is almost same as psyllium. It's another supplement, but it has slightly more side effects. For example, increase in size and choking risk is slightly common in case of glucomannan, and effectiveness in case of constipation is slightly decreased. So I would rate glucomannan with 6 out of 10 and psyllium 7 out of 10. And orlistat, I think it's best medication for weight loss, best supplement for weight loss. It's approved as a medication also in high doses, but in low doses it is sold as supplement in many areas. So what it does, it blocks pancreatic lipase. Pancreatic lipase is enzyme which is secreted from pancreas, and it is important for absorption of fats. And when person intakes fat, when person intake, for example, cake, which most part of this is fat, this orlistat inhibits its absorption, fat absorption, and this fat is excreted as a stool. That's very important action. It decreases fat absorption around 30%, and it looks like that maybe it's smaller, but actually it has huge effect. But it has also important side effects or adverse effects, which is problematic for people. It means that it can make stool more oily. It's discomfort for people, and urgency to stool, and sometimes it can cause diarrhea, and such negative and discomfort symptoms can occur. And also, if you intake orlistat for long term, it can cause vitamin deficiencies, especially fat soluble vitamin deficiency. So it's advisable to intake multivitamins before sleep to compensate this vitamin deficiency if person intakes orlistat for a long period of time. What is effectiveness? Effectiveness is around 5 to 6 pounds weight loss for 12 months. It's considered very effective actually, and from 6 months to 1 year intake is considered safe. So orlistat is intaken with food when you're eating, especially when you eat fatty meals. It's most effective when it is intaken with food to inhibit fat absorption. It's very important part. And orlistat is number 1, and I would rate it 8 out of 10. It's leader from this list. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.